All right. Happy Father's Day, everybody. Thank you all for showing up. We are the Naturopathic Doctors of Color. And we are talking about men's health today. So welcome. I'm going to let the doctors talk about themselves. So let's start with Dr. Kadija. So
Hi,
tell
friends.
everybody who you are, where you practice.
Yeah. All right. Hey, friends. Hi, everyone. My name is Dr. Kadija Douglas, aka Dr. D. I currently practice in Bucks County, which is just north, like 30-ish minutes north of Philadelphia, Pennsylvania. My practice is called Infinite Wellness, and we offer both virtual and in-person services. Obviously, a lot has been virtual now because of COVID, but that's what we do, essentially. I don't know what else you want me to say.
That's good.
Alrighty.
Dr. Patrick.
How's everybody doing? Good to see you all tonight. I am practicing in Miami, Florida right now. I am the CEO and Chief Healing Officer of Whole Kingdom Wellness. I am physically located in Miami, but I can be wherever you are as well. Great to see you.
Dr. Shelmire.
Hello. I'm Dr. Krystal Shelmire. I'm from Baton Rouge, Louisiana, but I own and operate alternative natural health solutions in Lafayette, Louisiana. And I'm here to service everybody in Louisiana that needs my help, naturopathic help.
Right. Dr. Nave.
Good evening, everyone. I am Dr. Nave. I am based in Grand Rapids, Michigan, but I work with women with an X, not an E, to reconnect to their identities by addressing their hormonal and mental health concerns. So I work with people locally here in Michigan as well as globally. So you can find me on Instagram or Facebook at Dr. Gaynel Nave to, if after this you want additional support, you know how to find me.
All right. And we will definitely at the end, before we wrap up, give all of our contact information and people in case people want to know more about us. I am Dr. Turshá Hamilton. I am currently practicing holistic counseling and health coaching and holistic naturopathic education in New Orleans, Louisiana. I do a lot of virtual education. Right now is the Holistic Healing Hypertension Holistic Health Summit. So I do things like that locally as well as online. And so that's me. And today is Father's Day. So I thought it would be a great idea for us to honor men by talking about how we can get men and keep men healthy. Get and keep men healthy. One of the things that I've noticed since I have been a student even is that men don't go to the doctor as readily as women do. It's sometimes like pulling teeth to get men into the doctor's office unless something is falling off or their man bits are not working. And so if it's not one of those, they're generally not gonna be going, right? So just trying to figure out ways to get men more interested in, more connected to their health so that we can have a more proactive male community, proactive health. So what are some of the things that you all have noticed about just in general having men come to the doctor since you guys have been in practice?
So it's usually going to be their partner.
Can you speak up a little bit?
Yeah, so it's usually going to be their partner or significant other or someone else that makes that appointment. So I partner with an organization called A Man's Cave that holds monthly wellness services and medical services. So they get consultation with me, blood pressure check, that stuff, and they get a massage and all these things. So it's like a full experience they're getting. And I'll tell you what I asked them, like, when's the last time you had a physical or screening blood work? And they're like, I don't know. They'll be like, you have to check with my partner. She's the one who brought me here. He's the one who brought me here. So it's the partner that's doing it. That's what I've noticed. And I don't know if someone else has seen differently, but it's always going to be, I didn't make this appointment. I didn't set this up. It was somebody else who made me come. Yeah.
Yeah, I definitely have noticed the same thing, especially when I was in school as a student clinician. I remember one case in particular, the couple came in and the appointment was specifically for him. And when we would ask him questions, he would look to his significant other to answer those questions. It's like he lacked awareness about his health, about his own medical history. And that, I believe, is like a huge barrier to healing, because if you lack self-awareness, then if something isn't going well, you might not notice it until it's like fire sirens level of fire, so to speak, as opposed to it's just starting to smoke. So,
which could also be why they don't go to the doctor until something is falling off, because they're not paying attention. There's not self-awareness.
Yeah. Yeah.
But I think it's important. I mean, I definitely echo what has already been said. An important woman in that guy's life is going to be a huge motivation for him to go. And sometimes I've found that is the only way you can get guys to come in. If you get that wife, that girlfriend, that significant other in the life, to be a motivational force. Now, I think it's also important to recognize, particularly as we are in a certain socio-political climate right now, that in the Black community particularly, there has been some deep-seated animosity or fright really for the medical community. When we look at historical experimentation and things of that nature that have happened to Black people, I can remember my grandfather telling me about why he was hesitant to go to doctors, and he would highlight to me how on his block where he in the place where he grew up, they wouldn't notice, like, one person went to the doctor and didn't come back. Somebody else down the street went and they didn't come back. Somebody else went down the street and they didn't come back. So I think over time, particularly some areas, there was a cultural development of a fear of that it meant something negative rather than a positive. And so, I'm not going until something is literally falling off, in that sense.
Mm-hmm. Dr. Shelmire?
Well, some of the men, I mean, I agree with what everybody else has said, but, what's unique about the area where I practice, out near Kadija, culturally, people have grown up, using herbs. Their grandparents is really part of the culture heavily there. So the type of people that do seek out naturopathic care, especially men, I feel like it's a little bit different. They're like, I used these herbs growing up. It worked. I see that I've tried these other things, but now I'm trying to get back to what I know will work. So yes, it does take a lot for them to come in. They're not coming in for minor things or things they think are macho, like pain. But like you said, when something is almost falling off, then that's when they want to come. But we're always available to help.
So to let you guys know, if you are watching us live, if you have any questions, please feel free to ask those questions. That's what we're here for. We want to make sure that your questions get answered. We want to make sure that if you need suggestions, if you have any concerns, ideas, let us know. Again, that's what we're here for. We want to make sure that we help you get healthy. We want to make sure we help you get the man in your life healthy. So whichever the case may be. Let's talk about screenings. So it's important, we as doctors know that it's important to get regular checkups. Let's talk about getting men checkups. How often would you like to see guys come into your office? What type of testing would you like done? Let's just kind of talk about that basic well care.
Okay, I'll start. So I'm very used to just being brought up with going to the doctor yearly for a yearly screening physical. And so it's interesting, in preparation for this, I actually asked quite a few of my male friends, like, do you go for yearly physicals? Do you get yearly blood work, like just basic blood work? And it was a resounding no across the board. So I think it's important because our bodies literally change from second to second, minute to minute. So I think it's important that you at least start with a yearly and getting screening blood work done. Like what's your blood sugar looking like? What's your basic blood count? Any signs of anemia? What infection? So I think just starting with that is really, really helpful in my opinion. And then obviously from there, you can figure out if they need to be seeing you more frequently. But I think it's important at least start with a yearly something, because things change in a year, things change in 6 months. So it's important to track that and monitor it.
Mm-hmm.
Other thoughts, docs?
Well, I know one of the
Hormones.
things I'd like. I know one of the things I'd like to see more consistently is for people to go get their prostates checked.
At what age?
Particularly, especially when you hit 40, or even a little before that, if you have any prevalence in your family. I have seen so many people who've died unnecessarily because they didn't go get checked, and it wasn't something that they just didn't see it as something that didn't need to get done. And besides, there's kind of this fear of getting it checked. I mean, you got to go into some places that folks don't want to have access about it to anybody. Listen, I'm saying it as a male. I mean, I've had to do that myself. So I mean, on both ends of it, and
literally and figuratively.
I intimately understand the trepidation. There's just something about that, you're like, but it's got to be done. It's got to be done. I mean, and I bring that up because being transparent, I have that sort of, I have that in my family. My grandfather passed away from prostate cancer. My father had a prostatectomy a few years ago. So it's like, hello, you got to make sure that that's there's something. But I have found that by and large that is a huge killer of males. Particularly black men. And we push it. We try to push it in our communities, faith communities, whatever that is. And I think it's still not happening at the rate it needs to be. It needs to happen.
Right, Dr. Shelmire, were you about to say something?
Yes, I was just about to mention like a hormone panel, because women, I mean, we have things that happen monthly, so it's easier to track our hormones, but men have hormones too. And with stress and everything else, those things can be out of balance. So it's not something typically people think to check, but I like to see more of that. Definitely hormones. And, we already know we have to do lipid panels, make sure, especially in Louisiana, the way people like to eat, you got to make sure the cholesterol panel is there.
Mm-hmm.
But
maybe eating boudin where you from too, huh?
Oh yes, the boudin capital of the world is like one exit up from where my office is. So
Nice.
definitely want to do a cholesterol panel.
Nice.
Yeah.
So I always like to talk to men about erectile dysfunction because I feel like that's probably one of the only ways I'm going to get them to hear me. So men or women or people who love them, high cholesterol, high stress, hypertension or high blood pressure, diabetes, heart disease, all of those can cause erectile dysfunction. And the medications for those can potentially cause erectile dysfunction. So if you can't get your man to go to the doctor for no other reason, tell him that if he don't get that checked, his people won't work.
Or talk to him about losing his hair.
Yeah.
Or
I will confirm that that's a very effective strategy.
Hair loss or the erectile dysfunction?
Which one?
Well, most of the erectile dysfunction.
It's erectile dysfunction that will get their attention.
Yep.
That's what I always hit them with. You're like,
Ears perk up.
Yeah, you got to hit them where it hurts, literally and figuratively.
Yeah.
So let's talk about. We talked about. Let's talk about prostate exam. Let's just go and get that out the way. I know that when I was doing prostate exams, I would have people ask me about it. I would have guys ask me about it. They would they would try to tell me why they wouldn't do it. And then they would ask me, you know, should I do it? And all these questions. And I'm like, all right, do you want me to give you the friend answer or do you want me to give you the doctor answer? And they're like, all right, let's give me both, but start with the doctor answer. And I'll say, you know, it's literally the test is 30 seconds, 45 seconds long. We go in, we feel around, and we're done. Like, it does not take very long. It's really more pride and, you know, fear, but the test itself is not a long process.
Mm-hmm.
And they're like, all right, what's the friend answer? I'm like, you need to get over that, because you're not getting this test until you're 50. Get over it. Women and girls have to go through this once they turn 18, and they do it once a year, and you get speculums and stuff cranked up in you, jugged up in you. You get cranked open, you open for half an hour, people sticking their hands and their elbows all up in your stuff, swabs and all kinds of Q-tips and brushes and brooms and everything, and people poking and prodding and looking inside you, and you just out in the open for 30 minutes. Your 45 seconds is absolutely nothing. Get over it.
Mm-hmm.
And they're like, oh.
That's a perspective change, yeah.
So how do you guys have that conversation?
For me, I talk about like showing love to the people in your life, and that not taking care of your health is basically not communicating that you love them. Because your family members, your loved ones want you to be around. Yep. And this test, like when it's done, once prostate cancer is caught early, it's the intervention. There's a high success rate with the interventions that are available. Yep. Same thing with testicular cancer. Like, guys, please check your testicles, and because testicular cancer happens under the age of 30.
Yeah.
You know? And so like, normalizing knowing your body is powerful, as well as you taking care of your health is communicating that you love the people around you.
That's a different way to say it. I'll have to start using that. All right. Anybody else? How do you guys?
I mean, I know for me, I mean, you know, as a man, you know, I think maybe I can say some things to them that maybe they'll receive from me a little bit better. In the sense of, I'm really just kind of straight up with them. Say, hey, look, man, you know, this thing's out here killing people, you know, and you know, I may even say to them, hey, look, you know, I've had that in my own family, and I know a lot of people who look like you and me who are dying unnecessarily because we're not checking this. Man, 45 seconds, man, it's worth it, you know, and that's kind of a, you know, I think, you know, maybe I can say that in a way that maybe some of us can't. But that's generally my approach. It's with man to man. Look, I feel you. I don't necessarily feel, you know, I don't necessarily want, you know, what's going on behind you either. However, the alternative, right? And so I may even touch into what Dr. Nave said too. You know, I mean, hey, don't leave your family out here like this. You know, and you know, one of those two approaches I feel is probably most effective for a lot of people.
Mm-hmm. Anybody else have thoughts? Different way they kind of communicate that?
I usually do it during, well, I mean, I go over, you know, just educate people at every visit about what they should do annually, you know, just all the preventative screening. But during the family medical history, I think that's a great time, especially if they have a strong family medical history, you know, just go through, educate them, like you guys already said, about what will happen. And if they've already seen someone suffer and they know the consequences, look, that 45 seconds, you won't even think about it when you think about what you're missing out on if if things go left. So I think just bringing it all into the reason why they even found you and sought out naturopathic medicine in the first place. They're trying to do better. So educate them on dosere and prevention as well.
Right. Dr. D, you have anything?
I'm very similar to Dr. Nave and her approach. I just am very honest. Like I say, we need you. Like your family needs you. I need you to be here, and I need you to show up. I need to see your face every month. You can do this. So that's the same approach. Essentially what she said is the approach that I take when talking about it. But then there's some people that might be stubborn that need a little bit more tough love. So that's when I'm like, it's 45 seconds. Suck it up. Thank you. I'll see you in a month. Like that's, so it's just knowing who.
That's how I like it. I like that approach. That part.
I think for me, when I'm doing more of the education, especially when I'm in the community, that's when I do more of the, we need you, do this for your family, know your why. Not only does your family need you, but the community needs you to be here and to be here for long term. That whole coddling. But after a while, it gets old. I be getting tired. I'm like, look, I'm tired of, no, just come on, suck that up.
Yeah. But I think it speaks to a need that we have in our communities when it comes to Black men. I think that Black men are strong and we have so much potential and strength and can provide so much for a community. But I think sometimes when it comes to caring for or being loving to a Black man, a lot of times we don't necessarily get all of that necessarily. Sometimes I think, and I'm just saying this, from my perspective, I think sometimes Black men don't necessarily. And then we look at what's happening in the world today. We don't get that same love that a lot of folks get, and I think the way we can show that love is to be more proactive in our communities in urging these things, having these conversations where Black men are gathering on a regular basis. There was one point I was going around, doing talks like this in barbershops, and just kind of, hey, let me talk to y'all real quick, and just, being in those spaces where they are and showing their concern and showing, hey, I want you to live, and I'm trying to give you information that's going to help you to live. And I think that is something that we need to do more of in our community.
That's a really good point. Go to where the people are at, meet them where they're at, where they congregate, where they feel safe, and then present the information.
There was actually an initiative, I want to say in the Phoenix area, like a barbershop initiative. Did you guys hear about that at all?
I caught some wind of it.
I think that's where it was, where healthcare providers, and it wasn't necessarily like naturopathic, but just healthcare providers would actually go to the barbershops and have conversations there, pass out literature there, pass out condoms there. Because as you guys said, like that is one of the places that men congregate. And so I think having like a barbershop initiative is a great idea, because as you guys mentioned, that is a place where men congregate, especially when you have these barbershops where people just kind of go early in the morning and then wait their turn. I've done that and I hate that. I don't do that anymore, but I know they exist. So yeah, I think that's a great idea. Working on some ideas. All right. So again, if you all who are watching the video, thank you first of all. Make sure that you share this video second of all. And third, if you have any questions at all about health, particularly health of men, any questions that you didn't know who to ask, we're here to answer your questions. So make sure that you ask those questions, because that's what we're here for. Otherwise, we're just going to talk and hope that we hit on some topics that you want to hear. So happy Father's Day to those of you who are watching, who are fathers. We want to see you here. We want you to be around long term, and that's why we're doing what we're doing. So Dr. Nave brought up testicular cancer under 30, and we know that prostate cancer happens usually to older men. And this is why it's important for men to connect with their bodies in a way that most of us are not really connecting with our bodies. We'll say that. Like, women aren't really doing breast exams. Men aren't really doing testicular exams. So let's talk about that. Let's talk about the need for men to start early with knowing what their testicles feel like. And then as they get older, how we can get them through that mindset of, transitioning into getting prostate exams.
Fear of God. Pictures. This is what happens if you don't get this exam. I mean, just straight to the point.
That works. Have you done that? Have you done that? Shown pictures? And
I do it to people I know personally, but I don't really. I'm trying to think how many men I get in that age group. I don't see very many in my practice unless like they're being dragged in by, like they said, fiance, wife, mother, something like that.
Okay. How do you guys have that conversation with them?
I explain it in the way that we sort of like learn in school. So this is what, I use the analogy that my mom taught me. So my mom works in the financial sector, and she taught me that you learn the truth so that you can tell the counterfeit without even really looking at it very closely. Mm-hmm. And so if we apply that to your health, if you know what normal looks like for you, mm-hmm. then if anything is skewed even slightly, you will be more attuned to being able to notice that. And so that's how I've approached it to the men who are in my close circle, because I don't really see a lot of men, and I'm in a state that's pre-licensed. So that's how I approach that topic. Like, hey, this is important. If you know what normal is like for you, then if anything is outside of that and you need intervention, you're better able to see and get that help.
Okay.
I guess it would start trying to educate them as early as possible. I mean, that's kind of the recurring thing that's kind of going on in my mind, is if we can start teaching our children at a younger age, mm-hmm. Proper terms, and like as their body's changing and puberties are happening, like this is going to happen during this age. I think if we start having those conversations about that, then maybe they wouldn't be so nervous or fearful of their own body. I think that's mm-hmm. important. So mm-hmm. kind of,
yeah.
That would be part of it.
So how can we get people to be less nervous and less fearful about what's happening with their bodies and use real terms? Part of the reason why I'm asking this is I recently taught mm-hmm. a group of young girls. They were 8 to 13, about puberty and the body and sex and like all the things. And I did that partly because I want to make sure that they're not like some of the 20-year-olds that I've seen that didn't know girls have 3 holes and boys have 2. Right. So, and just having some of these, like posting some questions on Facebook, asking certain questions, all of the names that people have used to describe the vagina or the penis over the years. And one person actually, one person said this. They said that, we need to teach children the real terms because using the fake terms can be a problem. So there was a child, I want to say it was a little girl, who went up to a teacher and told the teacher, and I can't remember exactly, told the teacher something like, he touched my pocketbook, right? And the teacher was like, oh, don't worry about it. It's not a problem. They, blah, blah, blah. Because the teacher was thinking they were talking about a pocketbook.
Purse.
Right. But then come to find out that's the name that the parent used for, her private parts. And so the teacher missed an opportunity to jump on, what this child said early because the child couldn't adequately communicate what was happening because she wasn't given the terminology. Thoughts?
Yeah. I mean, I think that's super important. I think it's super important, particularly when you think of a situation like you just said, the child doesn't know what that, is called. And then, obviously we see the issue with that. I know I found, one of the ways to get people more familiar is to really be serious about the education piece. Don't assume that, don't assume that your patients, are dumb or something like that. They're not, they can handle more than perhaps we may think. Now, obviously, I'm not necessarily going to pull out the netters or something like that.
That's what I do, actually.
I do too.
I may not pull out the netters in a sense, but I may show them something, maybe similar to that, where I'm showing them the exact anatomy and kind of just going over, hey, this, inside this testicle, this, inside this sac here, this is what's here. These are the structures that are there. And, when you ejaculate, this is what happens and this is where it goes.
Yeah.
And I think it kind of opens their mind to say, it's not as foreign in my mind as I think. And I think it does breed a level of familiarity. Yeah. And for some people, you may, you obviously want to measure that. Some people, they may not be able to handle certain levels of things. And so you may have something that's a little bit less. But for the most part, be as real with them as possible. Show them, a certain level of complexity, but something that they can understand and become familiar with. And I think that breeds that level of comfort with their bodies. And then questions.
Yeah. Dr. Nave, you were about to say something?
Oh, the points that you both brought up, and Dr. Douglas brought up with regards to the educational piece, I think it really needs to be what I call a bimodal way of teaching. So addressing the younger population as well as the older population. Because I remember growing up, like, the terminology that people would use for their reproductive structures and for, as you said, private parts like cocoa, and I feel the language creates this disconnect from yourself because you're using things that are outside of you and your experience to describe yourself. Does that make sense? So using things like food or inanimate objects. And so when we use the actual terminology, it empowers the person that when they go to the doctor, they can actually understand what you're communicating to them. And then also potentially decreasing the likelihood that if they're being experiencing molestation or other forms of like sexual trauma, that when they speak up, the adults in their lives will actually hear what they're saying. So,
I think for a lot of parents, part of the issue is if you talk about it in real terms, that'll somehow make them more curious. Like, I don't know. I'm not a parent. I'm guessing. But I feel like that might be the case, that some parents, don't want to talk about it because they feel like it might make them more curious. I don't know. So parents who are watching, please chime in. Let us know what you're thinking. Again, are any of you parents? I don't think so. No. None of us are parents.
Well, please chime in.
We need you guys to chime in. All we can do is talk about our book knowledge and what we've observed.
Yeah, and what we experience as children growing up and talking to other children.
Yes. So please again chime in. But I'll tell you this also, like one of the reasons why I do the class is because I know that parents sometimes have a really hard time actually having these conversations with their children. I actually had a friend who was like, look, I need you to come and talk to my daughter right now because I can't do it. I giggle. I can't use the words. I need you to come do it. I'm like, how far you want me to go? You do what you need to do. I just can't do it. So I think that also needs to happen. So again, those of you who are parents, if these conversations are hard for you to have, find somebody in your community that you trust that will give them real information so that your child is not out here listening to their peers or listening to stupid young people who might be a little bit older, teaching them about their bodies.
Yeah.
Well, I mean, I think you bring up an excellent point. I mean, I think we can't necessarily assume that the parents know either. You know.
And maybe that's something that needs to be addressed then too. like educating parents about their bodies, as well as like if it is that you feel as a parent feel uncomfortable speaking to your child. Sorry to interrupt you, my apologies about that. If you as a parent feel uncomfortable talking about these things with your child, yes, seek someone out who can communicate that to them, but maybe also explore why you feel uncomfortable talking about these things. Like, what are some stigmas or societal things that you have been taught about your body? Like, you've been taught about sex, that you've been taught about, like, you know, health stuff, because it will be beneficial for your children then too.
One of the things that that was interesting about the most recent class that I taught is it was 4 little girls. Like I said, they were 8 to 13, and I'm talking about the menstrual cycle, and I'm explaining it. And one of the girls said, "Actually, that's not true, because," and I was like, "Why do you think it's not true?" And she said, "Well, my mother said." It's like, all right, well, this is why your mother said that. She's actually incorrect. I will correct her, but this is the real story. So thank you for bringing that up. Anybody else? Comments?
Dr. Thomas was saying, oh, sorry.
Oh, yeah, yeah, go ahead.
I think Dr. Thompson, were you finished with your story? Dr. Patrick?
Oh, I thought you were talking to somebody else. I'm sorry. Yeah, I'm finished. I mean, I'll add some things.
Okay. Dr. D.
Yeah, I was just thinking, so I don't have kids, but my 2 nieces, I was thinking if my older niece, her body is changing, and I obviously don't recall my mom having the conversation, but I know that my mom has become, her grandmother has become a lot more aware of like saying the right body parts to her, and I don't know where that has come from, or I don't know if that's what she did with us, but I think it's nice. I know my mom is always like, I might not have done the best with you guys, but I could try better with my grandkids. So at least, she's getting more comfortable with having that conversation with my niece as her body's changing. And I'm definitely there to be like, hey, Auntie wants you in, and showing her the right way and teaching her and not to be afraid. So might be different when I have my own kids. Might not be ready for that.
That's all right. You have colleagues.
Right, I have
you have a whole village.
I'm gonna call somebody to be like, I need you to just have this conversation. Yeah.
Yeah, like Dr. Shelmire said, like I literally bring the netters and I'm like, plop the book in front of me, like, all right, this is what we're about to learn today. For girls and boys. I've done it more for girls, but girls and boys, I think it's important. All right, let's get back to men. So one reason why I wanted to talk about that was because, how we feel about our bodies, how we feel about getting annual checkups, how we feel about going to the doctor really starts when we're young. So that conversation needs to be had about how children are being educated and influenced about their bodies, about their health, about going to the doctor, and how manly that is. So speaking of manliness, matter of fact, let me shift a little bit. I want to talk about mental health for men. And all of it ties in, but I'm particularly thinking about, the pressure that society puts on men. I mean, especially men of color, especially Black men, but the pressures that men have. Right. Some of them are very similar to the pressures that women have. They just look different because we're looking at it from different lenses. But of course, some of them are very different. Let's talk about that. The depression, the anxiety, the fear, the hypermasculinity that all comes with that. I'm not really sure what I want to say about it, so it's kind of open for whatever comes to mind for you guys. So don't wait for a cue from me, because I gave it.
I'm glad. I'm glad you made that. I was actually, when you made that shift, I was thinking about that whole topic, mental health, and I really wanted to to share a few things about that. I had this graphic that some physicians who happen to be some of my fraternity brothers put together. And I've been kind of sharing it around, and I think it's very poignant when it comes to the mental health of Black men. And it talks about the fact that untreated mental health and unmanaged stress are some huge silent killers of Black men. Huge silent killers. It was saying that 20% of adult Black people are more likely to experience serious mental health than other parts of the population. And then to top that off, you got only 6.6% of Black men used mental health services in the last year. And that's a huge thing. And they presented about 5 different stressors, main stressors that for Black men. The first one was money and finances, being a huge stressor. Lack of economic opportunities, the ability to make ends meet. The second one was race and racism. Now we're seeing this now. We've seen it for a long time, many of us, but we've seen it coming to our head now. Negative racial experiences, dealing with institutionalized and personal and internalized racism, huge stressors affecting the mental health. Jobs and career, the third one. Difficulties with finding and keeping a job maybe and succeeding in a job due to various factors. The fourth one is relationships and family. Relationships with family, struggling in relationships with significant others, struggling in relationships with spouses, struggling in relationships with other family members and children. And then the fifth one was health and illness, right? Adverse health from a lack of good diet, lack of exercise, and chronic disease. So these are huge factors that are affecting Black men particularly in the mental health area. And so these are things that we need to make sure we're looking out for. I'll kind of leave that there. Maybe you guys want to comment on what you think about those factors.
I think they're all relevant and all excellent points that, you being an African-American male can speak on because you can relate to it. It's just like we can listen and see what we see on the media and know what we have, seen our family members experience, or just me speaking from a personal point of view. But it's just like we can never understand unless we walk in your shoes and see what it is that you go through on a daily basis. So all we can do is do what we do with any patient, try our best to empathize and, create a safe space so people can come and feel open to talk about those things and seek help. And, I just try to learn about all the resources that are out there, but no one really has the answers. It's just like this has been going on for a long time. And, all you can do is just try to develop stress management techniques or give people a way to cope with everything that's going on. And, that's how I would approach it.
Yeah. I think, when we look at these factors, and I think you're right. Sometimes it's hard to, particularly because the men a lot of times sometimes don't necessarily voice this stuff, and it becomes internalized, which is deadly. We know this. But I think, I think the world is able to see, in a large part now, given, the whole George Floyd incident. I've had several conversations of groups of Black men. Literally, we've gotten together and said, hey man, listen, I need to lean on you to process this, man. That is how it affected us. Seeing him down there and the whole situation, that affected, and it's still affecting brothers right now, on an emotional and a psychological, sense, and I can say from a personal standpoint, I feel the same way. When I'm driving down the street, now, I think a lot of Black people may feel this way, may feel a certain level of, and even Black women, may feel a certain angst when they're stopped by a police officer. But I'm gonna let you know right now, as a Black man, that's on another level. It's on a whole nother level. And I can tell you from personal experience, about 3 or 4 weeks ago, I got stopped by police around the corner from where I live. Got surrounded by people with guns. And I'm like, man, hey, I just gave some gas at the gas station, man. And I'm telling the police, hey, you know, relax, man. Like, I'm like, look at my hands, man. You know, chill, you know. Because I'm scared to death because they surrounded me and all that. They would get gas in the gas station. I was, you know, and so these are the things that, you know, Black men are dealing with on every day. So if you think about it, I mean, I've been stopped like that in every state I've driven in. And I've never driven drugs. I ain't never been in jail. I've never done that stuff. And I have experienced that on every state I've driven in, every one of them, you know, over years. So you can imagine, you know, what that toll it takes on a man, on, you know, mentally and emotionally. You know, it's a huge thing. And a lot of times we don't talk about it. But what we're seeing now is being uncovered now with the whole political, you know, social political climate that we're facing right now. It's kind of out there. You're kind of seeing it more visibly right now. And that's been something that's not new to us, you know.
Dr. D, any thoughts?
I have a lot. I'm trying to get my words together because everything I felt it completely. The mental health, I think it's another just reason why men don't go to the doctor. They don't want to say that they're struggling, and they don't want to say that they have these thoughts. It's a pride thing. And then, you know, you look at, and I can speak, you know, growing up in a Caribbean household, you go to the therapist, you're looked at, that's crazy. You don't need to, why are you in therapy, right? I think it's just something that's like such a taboo subject in the Black community as a whole. So to be like, to say that you're struggling or you're down or you're upset because you just saw somebody who looks like you be murdered, right? It's tough, but I think it's important that we acknowledge it. And I think it's important that we always, even as a physician, reach out to those patients who you know are probably going to be impacted by this, and not like force them, but always just reassure them that you're there, provide them with resources. Yeah, it's tough and my heart breaks. But I know I have tried to, like, I have a couple of Black males in our practice, give them resources to other Black therapists male therapists that they can speak to, and groups that they can go to, where they don't have to feel like they're at odds, and be thought of as crazy for going to seek help because of how they're feeling. So just supporting, not pushing, trying to have as many resources as possible. But, you know, hopefully one day we'll be able to get to a point in the community where therapy is not this like taboo thing. You're not crazy for going to see a therapist. That's the hope.
So who should see a therapist?
Everybody.
I also agree with this. I actually just made a post about it. Like, who is therapy for? Every single one of us. I believe therapy and Jesus. If you don't believe in Jesus and you have some other faith practice, it's your faith practice and therapy. It's not one or the other. It's the all. And so when you guys were talking, what came up for me is that how do we identify depression? How do we identify anxiety? Because anxiety, depression, and a lot of mental health concerns and challenges present differently in our male counterparts. Okay. And some of it has to do with societal conditioning. So we tell our boys not to cry. If you cry, I'm a mama man, or why you did buy your mother fractal? Why are you always with your mother? That. Why are you always by your mother's frocks or her dress? Why are you crying? You shouldn't cry. Man up. Pull yourself up by your bootstraps. All that kind of BS leads to those little boys then become men that lack the language to describe their emotional experience. It also cultivates not feeling safe, that if I share that I am vulnerable, share that I feel fearful, share that I am sad, that knowledge then becomes weaponized against me, and I am seen as not strong. And so then depression presents as anger. So we have a lot of men who are angry, and it's not really that they're angry. The anger is like a shadow emotion. What's really behind it is maybe that I'm fearful. you know, or maybe it's something else. Maybe I feel disgruntled, or maybe I feel like this person threatened me. And so I'm presenting with anger. I'm going to puff my chest to take up space so that this person can't hurt me. And so then depression gets missed in our men by the people around them, by us as healthcare providers, and by the men themselves, because they think, oh, I'm just angry. It's not a big deal, you know? Erectile dysfunction, that can be a symptom of depression or anxiety, because the psychological impact interferes with your ability to have an erection or maintain an erection or to have sexual satisfaction at all. Cheating, let's talk about cheating. That is a symptom of depression or anxiety as well, because they feel inadequate, so they seek pleasure outside of their intimate relationship to feel some sense of accomplishment. But we don't talk about these things. Men who are abusive, depression, it's a mental health, it's trauma, it's all of these different things that need to be untangled. But society stigmatizes mental health. We teach boys that you shouldn't cry, you know, and it's this massive thing that just drives me up a wall, which is why I do what I do, because I'm like, it's a returning to yourself. You're not just your physical body. You're not just your thoughts. You're not just your spiritual self. You're you. And all of those different aspects of yourself are a part of you. Denying it or pretending it's not happening does not serve you. It ends up harming you in the long run.
I think you're spot on, Dr. Nave. You are spot on. I like it. I like what you're saying. You're saying some real good things. You know, there's a couple of things you said I thought were very interesting. And of course, I believe that being in touch with your faith can be a huge factor in helping with these issues. I tell people this. I tell people, you know, every sane person I know has a therapist. Every sane person I know has a therapist. So there's a level that, you know, to which we got to try to normalize that in our communities, and that can be a touchy thing, because, you know, men, you know, they want to be seen as superheroes to people in their families. You know, they want to be seen as a superhero to their significant other, to their children. And they don't want to be seen to have those sort of vulnerabilities. But what I have found in my own experience is that sometimes what's necessary for that is for the men to develop some close relationship with other men, and to have that to be an impetus for that sort of sharing and sort of feeling of freedom to do that. You know, I'm very blessed in the sense that, I entered a fraternity in a few years ago. I was going to say a few years ago, and we, it's something, I know people have their thoughts about that, but I'm gonna tell you, it's been a huge blessing for me, especially in this time. You know, it's a group of us that were together, and we get together fairly frequently, and we talk. You know, when all this stuff was going down with George Floyd, when the stuff going on with COVID, when the other day, we got together and we talked about it, and literally we processed it, and, you know, we shared how we were feeling and the joys and concerns, and it was a very cathartic experience. I just think that if we could sort of emphasize those sort of groups and communities. You know, now, and we just talked about, hey, you know, if we can get the woman in this picture to be involved, I think that's true. But perhaps we need to make sure that we don't forsake the other side of that as well, to help men to foster good relationships with other men, so that they can feel comfortable letting this stuff out and processing it in a healthy way.
We're created for community. So if we have people who look like us, who are farther along on the healing journey, it gives us hope that we are able to heal as well. Yeah.
Right.
Yeah.
Dr.
And
Shelmire? Oh, were you finished, Dr. Nave?
it's fine. Go ahead.
No, I mean, she, like he said, she's spot on. I mean, you're absolutely correct with everything you're saying. I don't have anything to add. I'm learning. I'm like, yes.
So what can we do in our respective communities to actually facilitate having men, even if they don't go to therapy, create healthy communities where they can share with one another?
I feel like I've had a recent experience with, I don't see very many male patients, but usually they say, okay, you get the mom, you get the whole family. You know, by educating the mom, then she'll educate her husband, drag him in there and all the kids. But I feel like we don't give enough credit to men, because I had a recent male patient and, you know, it was a referral from another male patient. And I feel like once you educate one male on just how we view everything, like you mentioned, mental, emotional health with spiritual health, with physical health, and make them understand that it's all connected, and just teaching one person, each one teach one. You go and you, when you're talking in those communities to your you know, male counterparts, then you're educating them, who's going home and educating the next man, who's educating his son, and then everybody, you know, eventually we got our work cut out for us, especially here in Louisiana, but eventually, you know, you're making an impact. You may not be able to change the whole world, but you're changing one person's life, who's changing, you know, the next person, and then hopefully out to their community. And eventually we'll get to the point where everybody understands how holistic healing and naturopathic medicine works. But for right now, you know, we're just doing what we can.
Anybody else?
I mean, I like what you said in that sense, because, you know, I think it is important that if we can, you know, train one, and maybe that one can be, you know, help somebody else. I mean, I found that if you know, and this is, you know, even if you're like, you know, teaching in a classroom or something, if you can find that one kid, you know, who's the influencer in the room, and they may be the one that's acting the craziest in there. But if you can take them and lie, say, hey, come here, you know, you can be a leader. I want you to be a leader in this room. And then you may be able to change it, you affect the whole room because of that one conversation. I think it's the same way if you can find the influencer in that community. You know, that man that maybe people will listen to, that one that maybe is looked up to, and that they can, if they say something. I mean, and I think, you know, and I maybe I'm speaking for myself, but you know, I can think about several communities I've been a part of, and I can identify that male. That if that person says, hey, we need to do this, this is where everybody's going, right? You know, at my church here in Miami, you know, I had the privilege of treating one of the deacons at my church, you know, and, you know, he was having some pains, you know, he used to jump out of airplanes and stuff when he was younger, and so he's feeling around, you know, he's feeling that now. You know, I you know, I gave him, you know, he was interested. He contacted me, man, what do you think about CBD, man? What do you think about this? You know, and so you know, I gave him a few of those products, and the next thing you know, man, he came back the next Sunday and was like, yo, what was in this stuff, man? I feel like I'm 30 years younger. He was telling everybody. You hear me? He told all the rest of the deacons. He told other people in the choir. He told his family members. They was all contacting me because of what he said. Right. And so we could find that influencer in those communities, and you know, and so that allows for us to be able to affect the community in a strategic way. And I think, you know, that's what's really important for us. You know, in any of these things that we're doing, we got to be strategic about it. We can't just, you know, kind of just say, oh, we need to do this, but we need to be strategic and say, okay, we need to influence these communities, but how? And how do we do it? And how do we identify these influencers? And, you know, so we can have, you know, this impact in the community.
Okay. Anybody else have any thoughts? any words that you really want to make sure that, so we've been chatting for an hour and I've been looking and we don't really have any more comments. So we'll probably wrap up because I need to go hang with my daddy.
Same.
So, you know, there's that, but I wanted to make sure, what'd you say?
Some shrimp and some chicken on the barbecue.
It's something grilling right now. So I wanted to just have this conversation on Father's Day so that we can hopefully impact somebody in understanding how imperative it is that the men of the families are here, that the men of the families are around, that the men of the families actually take notice of their own health, be their own advocate, and pay attention to what's going on in their bodies, because it makes a huge difference in your own longevity. Don't just wait for your significant other to drag you to the doctor or give your medical history, because you know your body, or you should know your body because you're living in it better than anybody else because you're living in it. So like I said, we wanted to just have these conversations to hopefully spark some of that desire to want to get well and stay well. And if you don't take anything else from this, depression, hypertension, diabetes, high cholesterol, what else? Obesity, lack of exercise, all of those things can cause erectile dysfunction, prostate problems. All of them can cause erectile dysfunction. If you don't get anything else out of this, just know that your people won't work necessarily, or it could stop working if any of those things are not taken care of. So take care of them
Or if you take the medicines. Or the medicines to treat those things. Yes.
Yeah. Antidepressants.
Yes.
Hypertension medications.
Yes.
Antihistamines.
Yep.
Taking all that Benadryl.
Yep. Make you
Allergies.
drowsy.
So let's throw allergies in the list.
Yep. Allergies.
Yeah.
So if you want your manhood to work for long periods of time, come see one of us so that we can help you get well and stay well.
Yes.
All right. So docs, what I want you to do now is I want each of you to give like your last word. If they got nothing else from anything you said, what would you want them to make sure that they get away from get from this? And then tell us your contact information.
Alrighty, so I guess I'll start. I would say you can't serve from a cup that's half empty, so you have to make you a priority. That would be my big takeaway. And my info, Dr. D. So my practice is called Infinite Wellness. You can find me online, www.myinfinitewellness.net, on Instagram at myinfinitewellness. Our number is 267-217-3480, or you can find me on the Facebook, Kadija Douglas. We'll take care of you.
So could you do this for me? Could you go in the chat and type in your information? I was about to start doing it and then it got to be a lot. So while everyone else is talking, actually, if everybody who's not talking can go ahead and put your contact information in the chat, that would be helpful. So Dr. Patrick Thompson, where and how can people find you?
Okay. Well, let me first say, I thank you all so much for being and listening. For every man that's listening, every woman that's listening, we need you. We can't be a community without you. And so don't rob us of don't rob us of your brilliance and your communicate and your contribution to the world by just neglecting your health. We need you. Please, we urge you, please understand that everything about you is related and intertwined and connected. Yes. And if we really want to reach that health, we gotta touch those areas that we don't feel comfortable with. And if you contact any of us, we can help you to be more comfortable with that stuff. Yeah. All right. So my contact information, you can reach me. You can first of all, you can go to my website, www.wholekingdom.org. WHOLEKINGDOM.org. You can find me. I have a Facebook page, the same Whole Kingdom Wellness, and also I'm on Instagram at Whole Kingdom Wellness as well. So you can contact me at any of those places. and I would love to hear from you, and hopefully we can partner to make your health a greater priority for you.
Thank you. Dr. Shelmire?
Yes, I would just add, lead by example. Like for men, especially on Father's Day, you don't know who's watching. Especially if you have children, or just, like that was mentioned earlier, you may not even know that you're an influencer, but if you just lead by example, you could just touch so many other lives. So if people don't hear anything else, just know that the little people, like the kids, are out there watching. If you don't think about anything else, just think about the example that you're setting. And I'll send all my information, but my practice is Alternative Natural Health Solutions, and I'm Dr. Krystal Shelmire. Could be reached by email at kshelmirend@gmail.com, and I'll type all the rest.
Thank you. Dr. Nave?
Mm-hmm.
I would say that you are resilient. You are absolutely capable of healing, and you're much, much, much more than your pain and or suffering. And when you choose to address your health, there are people like ourselves, all of us here, who can partner in that healing journey so that your present reality doesn't have to be your future. You can find me on Facebook or on Instagram at DrGaynelNave. So that's at Dr. Gaynel Nave on Facebook and on Instagram. You can call my office, Hormonal Balance LLC, at 616-275-0049. I see clients virtually because the Rona and because my practice is mostly virtual. And so regardless of where you are in the world, we can work together because I do naturopathic education and consultation. What else? I would say, yeah, that's it. You can call the office at 616-275-0049. And you can follow me on Instagram, on Facebook, so you can see more of the type of content that I present and see if you resonate with that. So, yeah.
Okay. Thank you.
Mm-hmm.
And I actually want to expand on something that Dr. Shelmire just said. She said, lead by example. So one of the things that I've noticed is that when we get older, we're trying to unlearn some of the things that we did as younger people. So if you can start to influence young people so that they're not following your footsteps, so that they're learning now at young age what you're trying to learn and unlearn as an older person, you will be leading by example, and you will be setting the example that most of us wish we had when we were younger. So just keep that in mind, that your voice needs to be heard. Your wisdom, your knowledge, your experiences need to be heard. Be real with it, but also guide people in the way that they need to go. Go from there, and let people see you be the person that you wish you would have seen when you were younger. But you have to be here in order to do that. So take control of your health. Your health can improve. It's not too late until you're not here anymore. So as long as you're here, it's possible to heal. And that's it. Happy Father's Day to all of the fathers, the dads, the parents, the stepdads, the papas, the granddaddies, the uncles, the godfathers. Who else? The
Adoptive fathers.
The adoptive fathers, the pappy. Whatever you're called, as long as you are, a father or a father figure in the community, we love you, we appreciate you, we need you here.
Mm-hmm.
So be here because, again, we need you. Take care. Happy Father's Day. We'll talk to you soon.
Happy Father's Day.
Bye-bye.
Happy Father's Day.
Happy Father's Day.